We didn't get a lot of changes directly to Medicare in the new OBBB bill that President Trump just signed into law, but we do have some good news, and that is for people that are working past 65 that contribute to a health savings account, an HSA, not a FSA. So for those people, it's been a stupid rule that has caught people off guard for years. And the government actually fixed this little mistake that they inadvertently made. So the rule as it stands right now in 2025, and for the rest of 2025, because the new law won't save us until January 1st of 2026. The law says right now, if you are 65 or older, you cannot continue to contribute to a health savings account through your employer and receive those nice, sweet matching contributions from your employer if you have any other form of health insurance, meaning you cannot have Medicare Part A. Now, your HR director, all your friends at work, everybody you know at the bowling, they might have said, yeah, you always take Part A at 65. It's free. One, you don't always take it at 65. Two, it's not free. You paid for it. They took it out of your FICA payroll taxes your whole life. So it's paid up at 65 for the vast majority of people. You do not want to take it if you have a health savings account, because Medicare and the health savings account conflict for no logical reason other than when they wrote the law, it was just inadvertent. They screwed it up. And it's taken us this many years to get somebody to fix this. So if you're still in 2025, you could still be violating this rule, which would mean you signed up for Part A and you're making those contributions, which means at the end of the year when you try to do your taxes, you're going to get the 6% IRS excise penalty. Problems. Now, if you're just finding about this for the first time, you could back those contributions back out, have your employer back them out. I talk about that in my book. I have a chapter on health savings accounts and how to do that. So you can head on over to Amazon, get my book. As you can see, it is a big workbook, but there's one chapter on HSAs. Now you're going to say, well, Sylvia, why would I buy your book? Because they just changed the law. Because I have a dynamic QR code right there that will have any of the updates from the OBBB and any other changes. So you'll always have updates for my book. It's not going to go out of date. The majority of my book wouldn't go out of date in 5-10 years anyway, but they're always making little tweaks. Like I said, this is a tiny little tweak, but this is very helpful to people. And nobody knows this. Nobody knows you don't take Part A. Like I said, all your friends, everybody took it at 65. And for them without a health savings account, it didn't really help, but it sure didn't hurt anything. So the general rule is to take it at 65, unless you have an HSA. Now, again, I go into more detail in my book, but if you have an HSA right now in 2025 and we're in mid-year, when are you going to retire? Don't tell me that you have Part A and you've been making your contributions and you want to retire January 1st. Don't tell me that. Why? Because the law as it currently stands still, you have to stop all contributions, your own contribution and your employer's, sweet match, 6 months before you want to retire and enroll in Medicare Part B and A. So you're like, 6 months? I'm not really sure when I want to retire. Well, don't retire sooner than 6 months. You're like, why does that matter? Because the law as it stands, which has not changed, says that when you sign up for Medicare Part A and B past age 65, they make Part A retroactive back 6 months. Now, the government was trying to do a good thing and trying to help people by doing that, thinking that maybe you should have signed up and you wanted to, but you didn't understand the rules, so they made it retroactive. So it would cover, if you had any hospitalizations in those 6 months, you'd have coverage, even though you didn't sign up. So they were trying to be nice, which for most people would potentially be nice. But not for you if you have a health savings account. You have to stop all your contributions 6 months prior to enrolling in Medicare. Since that Part A is going to come back 6 months, you can't have contributions while you have Part A. So that's another hurdle that catches people. Again, if you're like, what? And why am I hearing about this for the first time? Remember, the government's not coming to save you. They're not going to call you and mail you and explain all your specific paths to retirement. No, you're on your own. You got to save yourself. So the rule will be much simpler next year in 2025. But if you're in 2026, make sure you know when to stop your contributions. Maybe you might want to delay filing for Medicare a month or two so that you don't trigger this IRS penalty for violating the current rule in 2025. I know it's a lot. I know it's frustrating. Don't kill the messenger. I'm just here to help. Again, if you learned something, I'd appreciate it if you give me a follow to my channel. I will keep you up to date on these crazy retirement rules. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.